Although some antibiotics can interact with alcohol, the risks are not the same for all types. Doctors will give different recommendations about a person's alcohol intake depending on the type of antibiotic they prescribe. Antibiotics are drugs that target bacteria to treat and prevent infections. There are many types trusted source of oral antibiotics. Although the risks of consuming alcohol may be lower with some types of antibiotics than others, it is still advisable to avoid alcohol intake while taking any antibiotics. This article discusses the risks of mixing antibiotics and alcohol. It also explores the effects of alkathirdistilled source on the immune system. Is it safe to mix alcohol and antibiotics? Oxydarnis tetstoxy. Not all antibiotics interact with alcohol. Depending on the type of antibiotics someone is taking, doctors may recommend limiting or avoiding alcohol intake. It is not safe to mix some types of antibiotics, such as tetracyclines and nitroimidazoles, with alcohol. This can cause dangerous side effects or make them less effective at removing bacteria. Nausea is a common trusted source side effect of antibiotics, and drinking alcohol may worsen this symptom in some people. Although nausea is a common side effect of both antibiotics and alcohol, not all people will experience this when using both at the same time. The risks of drinking alcohol are lower with some types of antibiotics. However, drinking any amount of alcohol still poses risks to a person taking antibiotics. Avoiding alcohol entirely during treatment will help a person avoid discomfort and other more serious consequences. Effects of mixing alcohol and antibiotics. This section considers the recommendations and possible side effects of consuming alcohol with different antibiotics. Tetracyclines. The tetracycline class of antibiotics includes doxycycline and minocycline. This class can treat a wide range of bacterial infections. People should avoid or limit their alcohol consumption while taking doxycycline. Alcohol can affect this antibiotic, and it may be less effective for people with a history of excessive drinking or those with alcohol use disorder (WADA). Liver toxicity is a rare side effect of taking minocycline. Since alcohol can also have negative effects on the liver, people should avoid mixing alcohol with minocycline. Oxyglycinase. Linezolid belongs to the oxyglycinose class of antibiotics. Doctors use oxyglycinase to treat abdominal, skin, lung, and urinary tract infections, as well as its antibacterial effect. Linezolid reduces the action of enzymes called monoamine oxidase A and monoamine oxidase B. Monoamine oxidases break down tyramine. Tyramine is a substance present in tap beers and red wine, among other products. When people drink tap beers and red wine with linezolid, the amount of tyramine in the blood may rise. They may experience side effects due to the increased tyramine levels, rather than the alcohol itself. People may experience the following: mild, moderate, or severe side effects after drinking these types of alcohol while taking oxyglycinase. Mild, moderate, severe: agitation, unusual sweating, rapid heartbeat, fever, altered mental status, rapid breathing, vomiting, abnormal heart rhythm, elevated blood pressure, seizures, coma, cardiopulmonary depression, muscle rigidity, muscle spasms. People should avoid red wine and tap beers when taking linezolid. They should also avoid other foods that contain tyramine, such as strong cheeses and smoked meat. Sulfonamides. Physicians prescribe sulfonamide antibiotics to treat urinary, respiratory, and abdominal infections. Sulfonamide antibiotics include the combination drug trimethoprim, which healthcare professionals also call Septra. Trimethoprim can affect the metabolism of folic acid in bacteria. In rare cases, it can also affect the metabolism of folic acid in human cells. People deficient in folic acid may be at risk trusted source of further reducing their folic acid levels while taking trimethoprim. People who regularly drink alcohol may have lower levels of folic acid and should use trimethoprim with caution. Although occasional drink is safe with sulfonamide, healthcare professionals should exercise caution when prescribing trimethoprim to people who drink alcohol regularly. Fluoroquinolones. In 2018, the Food and Drug Administration (FDA) trusted source published updated safety warnings on all fluoroquinolone antibiotics. The labels of all fluoroquinolones now highlight the drug's possible mental health side effects. These side effects may include disturbances in attention, disorientation, agitation, nervousness, memory loss, confusion. Mixing alcohol with fluoroquinolone antibiotics such as ciprofloxacin may increase these mental health side effects. In rare cases, People may experience seizures with fluoroquinolone treatment. People with a history of seizures are most at risk. Since alcohol lowers the seizure threshold, doctors advise people with a history of seizures to avoid mixing alcohol and fluoroquinolones. An occasional drink with fluoroquinolone can be safe, but regularly drinking alcohol may cause central nervous system side effects. Nitroimidazoles. Metronidazole is a nitroimidazole antibiotic that doctors prescribe to treat abdominal infections, sexually transmitted infections, and other anaerobic bacteria-related infections. Metronidazole affects the function of a key enzyme that helps the body digest alcohol. When metronidazole inhibits the enzyme aldehyde dehydrogenases, the levels of acetaldehyde accumulate in the blood. This causes the toxic effects of alcohol. Mixing alcohol with metronidazole may cause abdominal cramping, nausea, vomiting, headaches, facial flushing. People should avoid drinking alcohol during treatment and up to 3 days after the last dose. Despite this interaction, not everyone will experience these reactions when drinking while taking metronidazole. Still, people should avoid drinking alcohol while taking metronidazole. Summary table. The table below summarizes the recommended dismutted source and effects of drinking alcohol while taking different antibiotics. Antibiotic class. Antibiotic recommendations. Possible effects of mixing alcohol and antibiotics. Tetracyclines. Doxycycline. People should avoid alcohol consumption. Reduced effect of antibiotics in those with chronic OD. Tetracyclines. Minocycline. People should avoid alcohol consumption. No data. Oxyglycinase. Linezolid. People should avoid tap beers, red wine, and other foods with tyramine present. People with high blood pressure should avoid alcohol during treatment. Elevated blood pressure, vomiting, rapid heartbeat. Sulfonamides. Trimethamphetamine. Sulfonystificataps. Minimal risk for adverse reactions of people may consume alcohol in moderation and with caution. Facial flushing, heart palpitations, headaches, nausea, reduced metabolism of folic acid, fluoroquinolones, ciprofloxacin, levofloxacin, and moxifloxacin. People should limit alcohol consumption according to the trusted source. Disturbances in attention, disorientation, agitation, nervousness, memory loss, confusion. Nitroimidazoles. Metronidazole and tinidazole. People should avoid alcohol completely during treatment. People should continue to avoid alcohol for 48 hours after the last dose of metronidazole or 72 hours after the last dose of tinidazole. Abdominal cramping, nausea, vomiting, headaches, rapid or irregular heartbeat. Alcohol's effect on the immune system. Some research source suggests that moderate alcohol consumption is linked to a lower risk of infection. The Centers for Disease Control and Protection, a CDC or trusted source, define moderate alcohol consumption as 1 drink per day for women, 2 drinks per day for men. The CDC describes binge drinking as consuming 4 drinks for women and 5 drinks for men on a single occasion. Heavy drinking is 8 or more drinks for women and 15 drinks or more for men per week. Scientists have linked heavy and binge drinking with an impaired immune system. A trusted source. People with an impaired immune system have a higher risk of infection. Frequently asked questions. This section answers some common questions about antibiotics and alcohol. Which antibiotics should people not drink alcohol with? There are several antibiotics that people should not mix alcohol with. Not only can they interfere with the way the antibiotics work, but they can also cause a number of harmful side effects. Antibiotics that a person should not take with alcohol include metronidazole, tinidazole, doxycycline, minocycline, linezolid. The above list is not exhaustive. A person should speak with a healthcare professional if they have concerns about alcohol consumption and antibiotics. Will alcohol cancel out antibiotics? A type of antibiotic called doxycycline may be less effective in people with a history of heavy drinking. However, this is not the case for all antibiotics. A person may be able to drink alcohol in moderation and with caution while they are taking some types of antibiotics. However, a person should always consult a doctor before doing this. Taking antibiotics such as metronidazole and tinidazole while consuming alcohol can cause several unwanted and potentially dangerous side effects, as liver damage and seizures. What happens when you mix azithromycin and alcohol? Nausea, vomiting, or diarrhea, headache, dizziness, delayed recovery from illness, liver problems, dangerous side effects, drug interactions. Summary: azithromycin is an antibiotic. Combining azithromycin with alcohol may not be the best choice when the body is fighting an infection. It could also make bothersome side effects worse. Azithromycin kills bacteria in the body to fight bacterial infections. It does not work against illnesses caused by a virus, such as the cold or flu. It does combat a variety of bacterial infections, including strep throat, bronchitis, sinus infections, ear infections, some skin infections, tonsil infections, genital ulcer disease, helicobacter pylori infection, traveler's diarrhea, Legionnaire's disease, whooping cough. Azithromycin is safe and effective for most people when a doctor prescribes it for a bacterial infection. It does not have direct interactions with alcohol. Here, we discuss the potential minor consequences: nausea, vomiting, or diarrhea. Azithromycin can kill good bacteria in the body and cause stomach problems, such as nausea, vomiting, or diarrhea. Image credited to Anonymous 1041, 2019. Antibiotics, including azithromycin, can cause nausea, vomiting, or diarrhea. These effects may occur because azithromycin targets all bacteria in the body, including good bacteria in the digestive tract. When the antibiotic eliminates these good bacteria, the digestive system may go out of balance. This can lead to an upset stomach ranging from mild to severe. Drinking alcohol on its own can also cause nausea, vomiting, and diarrhea. Alcohol can irritate the stomach lining, and it increases the production of stomach acid. Drinking alcohol may also cause spasms of the intestines, which can push stool out too quickly. This can result in diarrhea. These effects, in combination with azithromycin, can increase the risk of an upset stomach, diarrhea, and feeling unwell. The body loses essential water and electrolytes when diarrhea occurs. Additionally, because alcohol is a diuretic, it may make these dehydrating effects worse, leading to more side effects. In addition, if a person vomits soon after taking the medication, their body might not have had time to absorb it. If this happens, a person should call their doctor to discuss whether they need to take another dose. Headache. One of the potential side effects of azithromycin is a headache. Though headaches do not affect everyone who takes the medication, combining azithromycin with alcohol could increase the risk of a headache or make an existing headache worse. According to the National Headache Foundation, drinking alcohol can trigger headaches in several different ways. It dilates blood vessels, which can cause pounding and pain, and it leads to dehydration and electrolyte imbalances. These effects explain why some people experience a hangover with a headache after drinking alcohol. If a person tries to treat their headache with a pain reliever, they could experience further side effects. Taking nonsteroidal anti-inflammatory drugs, such as aspirin or ibuprofen, may irritate the stomach, causing further digestive upset and nausea. People should not take acetaminophen with alcohol because it can lead to serious liver problems. This is especially true in people who drink alcohol every day or take high doses of acetaminophen. Dizziness. Many medical conditions can cause dizziness, or a feeling of spinning when a person is not moving. Dizziness is also a possible side effect of azithromycin. Dizziness can be bothersome and dangerous if a person needs work, drive, or operate any kind of machinery. Drinking alcohol can also cause dizziness and could magnify this side effect if a person is also taking azithromycin. Delayed recovery from illness. Doctors usually prescribe antibiotics for infections that do not clear on their own. These infections may be severe enough that penicillin will not work well. The body needs rest and nutrients to fight off infections, and alcohol can interfere with the body's healing processes. Alcohol can disrupt sleep, which could make recovery longer and more difficult. Alcohol inhibits rapid eye movement, or REM sleep, which is the most restorative type of sleep. It also disrupts the body's natural cues to sleep. Health professionals usually recommend proper hydration as the body recovers from an infection. Drinking plenty of water can help in recovery and the restoration of energy levels. As a diuretic, alcohol causes the body to lose water and minerals through the kidneys. This may make a person feel worse as they try to recuperate. While rare, azithromycin can cause liver problems. Symptoms of liver damage due to azithromycin include yellowing of the eyes or skin, nausea or vomiting, dark-colored urine or light-colored stool, extreme fatigue or weakness, stomach pain, loss of appetite, itchiness. The liver also processes alcohol. If a person drinks alcohol with azithromycin, the liver must work harder than usual and could become overworked. Usually, doctors will not prescribe azithromycin to people who have a history of liver problems. Masking of dangerous side effects. Most people tolerate azithromycin without issues, but it can cause serious side effects in some people. The following are symptoms of a potentially serious reaction to azithromycin: trouble breathing or swallowing, swelling of the throat, lips, tongue, or face, rapid heart rate, hives, itching, or skin rash, a new fever not related to the original infection. Symptoms of a liver problem. Drinking alcohol can make it harder to identify these serious side effects. For instance, a person may not notice fatigue and weakness from the medication if they believe that they simply drank too much alcohol. A person may also think that abdominal pain is due to a hangover rather than a reaction to azithromycin. Other drug interactions with azithromycin. Azithromycin can affect the way some medicines and supplements work. People should keep a list of all vitamins, herbs, supplements, and medicines that they take and tell their doctor and pharmacist about all of them. This can help prevent dangerous interactions. Azithromycin may interact with antacids that contain aluminum or magnesium. Blood thinners. Medicines for atrial fibrillation. Medicines for seizures or epilepsy. Nelfenavir, a virus beta, an antiretroviral drug that treats HIV. Summary. While alcohol does not cause dangerous interactions with azithromycin in most cases, it can make side effects worse and delay a person's recovery from illness. When taking any medication, it is best to ask a doctor before combining it with other substances, including alcohol. A person should always finish their course of azithromycin, even if they feel better. People should talk with a doctor if side effects are bothersome. Sometimes the doctor may prescribe a different antibiotic or recommend ways to manage side effects. Is it safe to mix Flagyl and alcohol? What is Flagyl? Possible effects. How do they interact? When is it safe to drink again? Safe usage. Summary. Drinking alcohol while taking Flagyl can cause serious side effects. Doctors and pharmacists advise people to avoid alcohol entirely while using the medication in any form, including oral Flagyl tablets and topical Flagyl creams. Flagyl is an antibiotic that treats many infections, including abdominal and sexually transmitted infections as TISA. While not all antibiotics interact with alcohol, drinking while using certain types of including Flagyl can have serious health consequences. People should generally avoid alcohol for up to 3 days after the last dose of Flagyl. In this article, we look at what Flagyl is and the risks of mixing it with alcohol. We also describe when it is safe to drink alcohol again. What is Flagyl? A doctor may prescribe Flagyl to treat various infections. Flagyl is the brand name of the antibiotic metronidazole. Metronidazole is part of the family of antibiotics called Nitroimidazoles. Doctors use Flagyl to treat anaerobic bacteria-related infections. Flagyl can treat and prevent the following: STIS, abdominal infections, skin infections, bone and joint infections, central nervous system infections, respiratory infections, infections of the heart's lining. The drug is also available in a cream, gel, and lotion to treat rosacea. Also, Flagyl-based vaginal gel can treat bacterial vaginosis in women who are not pregnant. Possible effects of mixing Flagyl and alcohol. Some antibiotics are safe to consume with an occasional drink, but Flagyl and alcohol interact in several ways. Taking Flagyl and drinking alcohol can have similar effects, which may be more noticeable when a person combines the two. People may experience the following side effects of Flagyl: abdominal cramping, nausea, headache, vomiting, seizures. Alcohol can cause the stomach and digestion-related side effects to be more pronounced. While some people do not experience the effects of combining alcohol and Flagyl, doctors and pharmacists recommend avoiding alcohol as a precaution. This can reduce the risk of Flagyl causing side effects. Alcohol may also lower a person's seizure threshold. Since Flagyl can cause seizures, people with a history of seizures should be especially careful to avoid alcohol while taking the antibiotic. How do Flagyl and alcohol interact? A person may experience headaches if they drink alcohol while taking Flagyl. When a person consumes alcohol, the body breaks it down into steps. First, it breaks alcohol into a compound called acetaldehyde. Acetaldehyde is toxic and responsible for the unwanted effects of alcohol. Next, the body reduces acetaldehyde to acetate. It does this with an enzyme called aldehyde dehydrogenase. Flagyl blocks the effects of this enzyme. As a result, a person on Flagyl cannot fully digest alcohol, and drinking can cause the toxic acetaldehyde to build up in the bloodstream. Because of this, people who drink alcohol while taking Flagyl may experience a disulfiram-like reaction. The disulfiram-like reaction. Disulfiram is a drug that helps treat alcohol addiction. Mixing disulfiram and alcohol has health effects that discourage people from drinking. A disulfiram-like reaction occurs when alcohol interacts similarly with a drug other than disulfiram, such as Flagyl. When a person combines Flagyl and alcohol, their disulfiram-like reaction may be mild to moderate and include nausea, vomiting, a rapid heartbeat, low blood pressure, headaches, flushing of the face. Authors of a 1996 case study source report the death of a 31-year-old woman who consumed alcohol while taking metronidazole. Reactions do not occur in all people. This may suggest that the risk of developing a disulfiram-like reaction to Flagyl and alcohol varies from person to person. Since doctors are unable to determine an individual's risk of this reaction, everyone should avoid consuming alcohol while taking Flagyl. The manufacturers of metronidazole-based creams, gels, and lotions cannot rule out the possibility of disulfiram-like reactions. Doctors and pharmacists should remind people using topical metronidazole products to avoid alcohol. When is it safe to drink alcohol again? The interactions between alcohol and Flagyl, specifically Flagyl's inhibition of aldehyde dehydrogenases, may continue for up to 3 days after a person stops taking the antibiotic. As a result, doctors and pharmacists generally recommend avoiding alcohol while taking Flagyl and for 3 days after the last dose because of the risk of side effects. For people applying metronidazole products to their skin or using the vaginal gel, manufacturers recommend avoiding alcohol until 24 hours after the last application. How to use Flagyl safely. A person should not consume alcohol until 3 days after the last dose of Flagyl. Flagyl can accumulate in the bloodstream of a person with impaired liver function, and doctors prescribe lower dosages to people with severe liver disease. People with renal failure have a similar risk, and doctors will watch carefully for signs of accumulation. The drug can also accumulate in people over 70 years old who have no signs of liver or kidney failure. Doctors will prescribe the regular dosage to older adults but monitor them closely for side effects. Doctors and pharmacists should advise everyone taking Flagyl to avoid alcohol while using the drug and for 3 days following the final dose. People applying the antibiotic topically should avoid alcohol throughout treatment and for 24 hours after the last application. Summary: Flagyl is a common antibiotic that doctors prescribe to treat a wide range of infections. People should not consume alcohol while taking Flagyl. The interaction between Flagyl and alcohol can continue for up to 3 days after the last dose. If a person uses the antibiotic topically, they should also refrain from drinking during the treatment and for up to 24 hours after the last application. Although the interaction between Flagyl and alcohol is not consistent, everyone should avoid drinking while taking the antibiotic because of the risk of side effects.